And good morning, it's Cinco de Mayo here at Deuk Spine Institute. It's May 5th, 2023, and I'm sitting with one of my patients who traveled from Ohio because he's been suffering with back pain for many years, as well as pain down his leg. And I'm going to let him tell you about that in a moment, but first, how are you feeling today?
Feel excellent. My back pain's gone. Feel like a new man.
Awesome. And your leg?
Leg, I just have a little cramping yet from walking off out of kelter for so long. I'm compensating for my back, so I've got to work through that a little bit. Yeah, we knew that would be, but the back is excellent.
Good. And how long did you have back pain for?
25 years ago, I did some stupid lifting and bulged discs out and then just lived with them. I didn't want to do conventional surgery, which I'm glad now that I was always waiting on a less invasive surgery. And when I got reading about the doc, that what he did and the procedure and all the success rate, just thought, I did a lot of praying about it actually.
You were offered other surgeries and you chose not to do them.
Yes.
That was smart.
Yeah, I was afraid of conventional surgery.
And what convinced you that the Deuk laser disc repair endoscopic surgery, which you can actually see right here in the video, was done with a small incision on your back, 7 millimeters or 8 millimeters. What convinced you that was the right treatment for you?
Well, because I didn't want to be tore up from, a big wide incision and all the cut muscle and the scar tissue that probably was going to end up with. I've heard about, saw a lot of people in my business come in, hardware store, that had surgeries, and some were better for just a little bit and back into surgeries again, and just never ending. It seemed like once they started, it was never ending. So I was looking for something that was totally different and perfected.
Definitive.
Yes.
So you can move on with life.
Yep.
What's life look like for you now that we fixed your back?
It's good. I want to get back to normal activity, use my head, not abuse myself like I have over the years with working with masons and plumbing and water heaters and a bunch of massive lifting all my life. Just going to try to live a good retirement life and work light and keep on going.
A lot of surgeries that are done on the spine require patients to take powerful narcotic painkillers afterwards. Are you on narcotic painkillers?
No, nope. I took one Tylenol this morning because I'm going to be driving 3 hours, and that's all I've taken.
So basically the result of no pain in the back, it's not because we're covering it up with medicine or anything.
No.
Yeah.
No.
That's
I rolled
right.
over in bed at night and it was unbelievable. I laid awake for a couple hours just thinking about the amazement of it.
Praise God.
Yeah, for sure.
Well, is there anything else you want to share with your audience?
I just advise anybody that get an MRI and send it. It sounded goofy doing it online, but it sounded like it was too good to be true. But as you read about it and what he's done, it's the real deal. Yep.
Congratulations.
Yep.
You
Thank
had
you so
faith
much.
and it's paid off for you.
Yeah.
Enjoy yourself.
Okay.
You have a lovely wife too who's been very supportive. I know she's been suffering along with you,
oh,
right?
Yeah.
As spouses often do, watching their spouse suffer every day with pain. And I know it's been hard on her.
Yeah.
And she's such a positive force in your life, I can tell.
She is.
She's got a lot of good energy there.
Yeah, 44 years of it.
Well, you take care, sir.
Yep. Thank
Enjoy
you.
life.
Thank you so much.
You're welcome.
Yeah.